Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. And with me today is Joe Russell, the health officer for the Flathead City County Health Department. Hi, Joe.
Hey, Ryan. How are you?
All right. So, Joe, the big question of the day, of course, is the distribution of the vaccines. I know we got that rolling in the valley here. Things are looking like they're going all right. Could you give us kind of a status update of where we are on the vaccine distribution?
Sure. So we have been vaccinating at the fairgrounds for 4 weeks and slowly ramping up. For a while, we were getting Moderna 100 doses, pretty small allotments, but things have kind of picked up. We've moved to that 975 tray of Pfizer, working closely with the hospital. So we're working in a unified command, and we're delivering, 1,200 doses, at least 1,200 doses a week for the last several weeks now. So we're starting to move where we want to be, get the vaccine into people's arms.
Yeah, that's great. And so where are we in terms of the prioritization of population? So obviously we're hitting the elderly, I believe, first. And what's that kind of order and where are we in that order?
So we moved fairly quickly through 1A, which was healthcare providers. 1B is the governor set some different tiering than what we would have expected through CDC. So our tier 1B is 70 years or older, people of color, and that doesn't matter what age you are as long as you're over 16, and people with underlying medical conditions. So, the list we post on our website, and it's probably best that I don't try to recite it, but COPD, obesity, diabetes, immunocompromised due to solid organ transplant. I always remember that one for some reason. So it's a list of about 8. And then the last one on there is if your physician feels that you have an underlying medical condition that puts you at high risk, they can order that patient, that person to tier 1B and get them vaccinated.
Mm-hmm. And at the rate we're going, when would you anticipate, maybe you don't know the answer to this, but getting through the adult population in the valley for those who want it? What kind of time frame we're looking at?
So Ryan, if we just think about tier 1B, we've always kind of set a target that we'd be somewhere in May before we got through this tier 1B. We're going to have to set up a little more aggressive call-in, because right now what we had this big surge of people that wanted to get vaccinated. And I think a lot of people that are hanging back still, but we had right now our really good list is about 5,000 unique entries in it. And we're scheduled about half of that right now. So you can figure in 2 weeks, we're going to be through our good, clean list. We actually have another 4,000 that may be duplicative. We have some cleanup to do in that, but we probably somewhere around 3.5 weeks of individuals that want to be scheduled for vaccine clinics. And these are 2 doses. So every time we do 1 dose, 3 weeks from now, we're doing another one. So we set our target for about a tray of Pfizer new doses a week, plus coming up on second doses here in a week and a half. And that's 800 doses that's about 800 doses a day. Special this Friday, we're going to really test our system. We're going to do 1,000 doses on this Friday coming up, and we'll see how our system's working. But the way we set up in there, most people feel pretty comfortable. It's a comfortable environment, but it's cleanable, and we keep that social distancing. So we don't want people to contract COVID-19 at a vaccination clinic. So we take it pretty seriously about social distancing in there, and we can run about 9 vaccinators at a time, scheduling 5-minute appointments, and we can get through 120 people an hour. So just to give you an idea, that's 9 to 3:30 for 780 doses. So we've got a good plan. We feel comfortable moving forward with it.
Yeah. Are you encouraged that there's such high interest in getting vaccinated? And was that a surprise for you?
You know, I actually thought this group would be pretty good because they're a population, a cohort that's generally receives influenza vaccine. So they're not averse to vaccine. So I kind of thought the uptake would be over 60% in this group.
Mm-hmm.
Once again, this is not a group that probably had COVID-19 disease because they've been doing very well to social distance and mask use. Very few people come through and say, geez, I had COVID-19 only 2 months ago. This is a pretty naive population to this disease. So I thought our uptake would be 60. I'm hoping it's a little higher.
Mm-hmm.
When we fall into these other tiers, I think the uptake will be lower. And I think a lot of them will have had disease. The nice thing is the CDC just came out, and a lot of people will be happy to hear this. You are conferred the same level of quarantine as now that if you're vaccinated plus 2 vaccines plus 14 days is the same as having disease. So let's say you were a close contact, but you were fully immunized, you wouldn't have to quarantine. Just
Oh,
like if you were, so that's a good
that's
step.
nice. Yeah,
It's
that's
a
nice.
good step. So we always knew the CDC was going to do that. We just didn't know when, but they're doing it.
Yeah.
We're going to get a health alert network out tomorrow that's going to give that durable immunity to people that are vaccinated too. So I think that's going to help people say, hey, this is an important vaccine.
Yeah. And so the folks to know that they're in the group that's eligible to come in and get the vaccine, are letters being sent out to those folks? How do they get notified, or is it just up to the individual to know that they're in the list and to get in contact and come in and get vaccinated?
Yeah, good question, Ryan. There's a lot of ways to do this. First of all, you can always look on our website to see if you meet Tier 1B. But if you call our phone number, the one we're using for the call center, you will literally, before you're ever scheduled, we will triage you. So we'll actually ask you the questions. Are you over 70? You know, if you give a date of birth, we don't even have to go any further. You're in, you're on. But if we have to get into the underlying medical conditions, we do ask if they meet any of these underlying conditions.
Mm-hmm.
So we'll do that. We do have an online form that kind of moves them through the system, mostly the same way. It kind of they have to triage themselves. But we literally like to have a conversation with them so they know that they're on the list. This is a group of people, most people like to hear a live voice saying, hey, you're scheduled, or you're going to get scheduled. So we get a lot of callbacks from people very concerned that they've missed a call, or it's just the way life goes. We all experience the same thing. And this is a group of folks that really, some of them get very emotional when they get this COVID-19.
I bet. What a relief. I mean,
Yeah,
the stress of it's just,
yeah.
you know, been hard
That's
on everybody.
it's literally a distress that some of them literally cry because it's that important to them.
I believe it. Yeah, I believe it. Well, I'm curious your thoughts. You know, if you could say something to the folks who maybe are concerned about the safety of the vaccine, just your confidence level in that safety, and what you would say to those folks who are maybe questioning whether or not they would get the vaccine.
That's great. This is one of the things that I think is the most important thing we can tell people. Folks that have a severe reaction is very, 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 very low, 1 in 100,000. We know that this is a vaccine, a very novel vaccine. It's literally it's a messenger RNA modified. So everything, it kind of slips in without detection. They had to do some modification, but it's literally just a little piece of genome, little genetic material that's encased in some fatty acetates to protect it. There's nothing else there. That's basically the delivery system. And so, we had one of our nurses came up today and said, Joe, someone asked if this was an attenuated vaccine. Well, an attenuated vaccine is literally the virus that's been attenuated so it won't cause disease. This is so far away from an attenuated viral vaccine. This is literally a piece of genome that we insert. And so Pfizer and Moderna are basically the same thing. And they just code for that spike protein, which is very prevalent in the coronavirus, and incredible immunity. And we're talking efficacy of 95% in these two vaccines. This is unheard of. And so, I mean, I get excited about this stuff because all of these vaccines, these new delivery systems, the J&J and AstraZeneca, they're a newer delivery system too. They're a viral vector. So that is an attenuated vaccine per se, because we're actually putting in an adenovirus and putting it in to get that genome in. Once again, the adenovirus that they use doesn't cause illness. So, I keep thinking about this, and whether it's the messenger RNA or the viral vector, super safe, seeing very little problems with people that are vaccinated. When we vaccinate you at the fairgrounds, we literally have retired medical doctors working in monitoring, and they're checking you. They're making sure that you're doing okay. And, we make you sit for 15 minutes, and we're literally taking it very seriously about reaction.
Mm-hmm.
And,
Mm-hmm.
with the amount of medical doctors that we have in there, everyone should be super safe. It's probably safer than going to a grocery store.
Yeah, and I think that is so important. The confidence that comes with understanding how the vaccine works, the way it was created and how it works, really, it provides that confidence, I think, understanding
it's
that.
a wonderful, I mean, to have this type of technology, to be able to roll a vaccine out so fast that has such high efficacy, this is a scientific marvel, and we need to be grateful. And now we have two more coming into the system, and we just need to get people durably immunized.
Yeah, yeah, absolutely. So let's talk about the COVID numbers. We saw a spike kind of towards the end of last year, but those numbers have really come down in recent months, and they're looking a lot more positive. What would you say? How do you perceive those numbers? What are you looking at, and what do you see for the future here in the coming months?
So optimistic, certainly. I mean, I'm a little bit concerned about these new variants and what they could do in Flathead County. But right now, if we don't see these new variants, and we're seeing that downward trend, the stuff that everyone likes to hear about. So we're getting the downward trend. We're still seeing 30 to 40 new cases on average a day. From a case investigation perspective, it's very manageable. I'd like to see that 5 to 10 cases a day. That would be wonderful. And that time will come. It will come, but it's not time yet. We just don't have enough people that have any immunity in our system, and we have so much asymptomatic or mild symptomatic cases that we're not picking up a lot of the disease, and that's where people are probably contracting it, is these mildly symptomatic. Oh, I have a little stuffy nose today, or asymptomatic. I feel great, and they go out and have a little excursion into disease transmission.
Right. And those new variants really are the unknown question. I've been looking at them. They're you said we don't have them locally yet, which is great, and hopefully we won't. But they are a concern, aren't they? Because they're a little more infectious, as I understand it, and could lead to a bigger spike if we get it locally.
Ryan, it really could. My hope is that the people that are the highest susceptibility, this tier 1B, hopefully we keep pushing through it, and we're not going to see a lot of disease uptake in our community, especially in those that might die from it. And a lot of people don't understand this, but we do have deaths from COVID-19, and some of them could be averted, and that's that's why public health is so keen on vaccination and even looking at some of these other control strategies. And they work. We see they work in the schools. Right now, Ryan, the schools, transmission within a school is almost nil. We get so little. It's the extracurricular, the social activities that the school age children do. But in that environment, when those schools impose those strategies, we're just not seeing it. And we see very little occupational transmission of COVID. You know, those settings where you do have good mask use, people are social distancing, possibly working from home. You know, some of these things that keep the people spread apart. Those are all things that are really beneficial in keeping the transmission down. And I think we practiced pretty well about that. I think I might have used the term social burn through at times. And I think that there is a social group, you know, some that might be attending bars, they're probably contracting it because that's a perfect environment for it to happen. A little bit of alcohol, volume goes up, you're in right in front of someone. I mean, it happens in church groups too, where they have social settings. We see these things where they do occur. And, you know, it's a droplet spread. It's not easy to catch, but it's not uneasy, if you know what I mean. If you put yourself in an environment where you're not social distancing, where you're not using a mask, you could easily contract it if someone was in that environment. So, you know, we still have to take precautions, and we just don't know that underlying amount of who's had the disease yet. You know, we know the confirmed cases, but my guess is that this is a lot like many communicable diseases. You have so many that go unlab detected. We could have 3 times more people in this community that have had COVID. We don't know that because we're not doing the antibody testing and such. So I'm just hoping that maybe someday we'd start to do some cross-sectional analysis and really get an idea of how many people have really had it. We may be closer to durable herd immunity than we even know.
Wouldn't that be nice?
Yeah. Supposition at best.
Yeah. Well, and speaking of the precautionary measures, you know, I did see that the governor announced by the end of the week he's going to repeal the mask mandate, and hopefully, you know, folks in the community will continue to use those precautions and wear masks because they are effective, and even if there isn't a mandate to take those precautions.
Yeah, I have thought that a lot about how the governor started. I was hoping he would keep this on for several more months until we really did get through Tier 1B. He did state that he'd like to see that. I know he's getting a lot of pressure. I know he's probably getting as much pressure to take those masks off than to keep them on. And you know, he's got to make the decision. I just know that in communities that have corporations that operate in multi-states, and you know the types I'm talking about, they're probably not taking their mask mandates out of their stores. And what they're going to do is this is the thing that really concerns me, they're going to cause confrontation. It's going to cause more confrontation without that governor's mask mandate, with or without a strong regulatory presence. It doesn't need to be regulatory. It needs to be, hey, do this for everybody. And now we're going to have corporate stores that are going to say, no, I don't care what the governor said. You're going to wear a mask. And the conflicts will start again, just like they did in March and April. You know, some of the nasty stuff that you saw on national news, it's just not good for our community. It wasn't good then, and it's not going to be again, most likely.
Yeah, no, you know, the mandate, one of the things that was helpful of it gives those businesses the excuse to say, hey, I'm just, you know, following the law, and I'm asking for your compliance. And with that going away, you know, then I agree with you. I think it'll increase conflict, unfortunately, but we'll see how it goes. Hopefully folks in the community, you know, we have a lot of great folks in our community, and hopefully they're respectful and following those precautions. So, well, we are just about out of time, Joe. Thank you so much for joining me. And I wanted to say thank you for coming on board as the health officer. I know there wasn't a lot of folks lining up to do this job given the circumstances, and you stepped up to come in and do it again, and I very much appreciate that. I know it's a difficult job given the circumstances. So
Well, the nice thing is I knew the system. I helped
yeah.
build it. And I can't ever figure out if I'm the new old health officer or the old new health officer. You gotta figure that out. But I know the system. I know a lot of the people. I hired a lot of people still here. It's a great crew, and it's really easy to work here. And I don't want to do it for a long time. I really did enjoy retiring. I actually not retired. I was teaching and doing some consulting, and I'd had to put all of that stuff aside to do a more than full-time job. But this system and this community mean a lot to me. So I was expecting the call. I didn't know when it would come, but
Mm,
I knew it was going to come at some point. So I'm going to
yeah.
relish it. I'm going to enjoy my staff and enjoy the public health that we're doing.
Yeah, well, we all thank you for it. And thank you for coming on the program and sharing the knowledge. There's so much to talk about here. We could go on for a while, I'm sure, but the important part is that we're getting the vaccines out there, and hopefully we see the end of the road here this year with this virus, and get through it. So thank you so much, and everybody at the health department, for all the work you're doing.
All right. Thanks, Ryan. Really appreciate your show.
Thank you, Joe.